Thank you. What if we decided that this is a good time to reimagine medicine? Let me take it a little further. What if we gave ourselves permission to believe that we could reinvent medicine? What would we do? How much of what we consider established, accepted, sacred, are we prepared to challenge? How far do we think we would be willing to go? What if we could reinvent medicine? These kind of questions in a different sector were being answered probably without knowing it by a very young man, pictured here in the 70s, who was an employee of a big company. And by the way, who can recognize him? Raise your hand, please. Let's see. So much for fame and impact. His name is Steven Sasson. He was about 24 when, as an electronic engineer, he joined the team, and his boss apparently couldn't cope with his questioning. He was too much of a pain in the neck. And his boss said to him, go tinker with some gadgets, gave him a new piece of technology, and off he went with no budget and perhaps just one assistant. Less than a year later, he came with this, an 8-pound contraption that he had managed to create, taking spare parts of different things he found around him. And he said to his boss, "Look, this is a handheld digital camera." And the boss said, "What is this?" He said, "Well, you press this button, you take a picture, you don't need film, this goes into a cassette, and it gets stored there. It takes about 30 seconds, and we can watch this on a television screen." The boss looked at him and said, "Nice. I think we need to discuss this with management." They went to talk to the bosses of the company, and the response was, "Who would like to take pictures without film and without printing the photographs?" Just in case, let's patent this thing. And please, Steven, don't tell anybody about this. This was 1975. At that time, this company, one of the biggest in the world, had 90% of the market of cameras and film controlled. And of course, they depended on film, on cameras with movable parts that could lead to printed photographs. Fast forward to 2012, they were basically gone. What happened? What happened to them? They managed not only to patent the first portable handheld digital camera in the world, 20 years later, they kept working on digital photography. 20 years later, they released the first commercial digital camera in the world. But they did this to protect printing of photographs. This camera could take photographs that then would be printed on paper. They were the first company in the world that allowed the transfer of photographs digitally through the web. But they did that to ensure that you could print the photographs. So they were protecting what they held so dear to them and what they believed was photography. You had to take images and print them. Okay? Now, we are probably taking more pictures than ever. We don't need cameras with movable parts. Okay? We just do it. And at events like this, or at the Raptors celebration, it would be very rare if we find somebody with a camera, okay, hoping to print the pictures that would be captured then. So photography is probably more successful now than ever before, and yet the company that witnessed the birth of digital photography is pretty much gone. What if there is something similar happening in medicine? Okay. What if our confirmation bias, which some consider to be equivalent to a natural law, you see, we believe what we want to believe, and we take evidence only if it agrees with what we already believe, and we reject what doesn't. What if what we could call oblivious to the obvious bias, okay, was taking place now? What if we are experiencing a similar moment to what was unfolding in 1975, and that was practically impossible to believe? What if our very existence is under threat? And that while that is happening, we are just worrying about fees, about cost of pharmaceutical products, about burnout, about how we are treated, about whether we should be using the internet to communicate with people. Others have been conceiving a world without medicine for a while. Imagine a world without medicine. What if reimagining medicine requires thinking that it is possible for medicine to cease to exist? What if we don't do it? Okay. What if others manage to achieve what they have been predicting for a while? That these very tools that now we consider potentially useful to transform how we connect with each other and how we provide services or receive them, what if these very tools, okay, are pregnant with the seeds of our destruction? What if the biggest threat is at the heart of what medicine means? Apparently, the word medicine was used for the first time in the 14th century, so it's not something that has been with us for a long time. When Hippocrates was practicing, medicine wasn't a term. When Galen, for more than 1,000 years, was influencing medicine, or how medicine wasn't a word. And medicine is about disease. It's about diagnosing disease, treating disease, and at best preventing it. Could we imagine a world without diseases? This was a paper published in 2004 by a couple of colleagues in the US who were able to do that, and it was largely ignored. A world without diseases. A world without film. What if what we now know as precision medicine would facilitate the disappearance of disease? Because in a way, what precision medicine is doing is inviting us to imagine a world in which each person would have a combination of elements that would be responsible for a condition or an illness that would be so unique that would take us back to what Galen used to do with the humors, to produce a profile for each person who would need healing. And this precision medicine, which is developing very, very quickly, is also threatening what we call evidence-based medicine, because if each person is unique, then data from clinical trials or observational studies that combine information from multiple people will cease to be relevant. So this is already happening, beginning with cancer. Breast cancer first, prostate cancer next, every cancer. Very soon, to the point that some believe that the word cancer means very little, that is equivalent to say infection. Okay. So what if all these new tests, immunological, humoral, pathological, allow us to give each person his or her own profile to make, you see, the notion of cancer as a disease just a historical fact. This is happening with diabetes too. Okay. Are we prepared? Are we prepared to give ourselves permission to believe that this is possible? That's a key question. Are we prepared to conceive of medicine without disease? So we talk about healthcare, but they really mean medicine. Very few times we find ourselves talking about health itself. But there are lots of people talking about it outside our realm, and they are usually invisible until it is too late. And some of these are like passengers of this big ship coming, who are making huge investments in transforming how we perceive medicine, healthcare, and health in particular. And this is a group similar to the one that basically eliminated Kodak and all of the organizations that had control over the photographic world. And they are no lambs. These three characters, the head of the most valuable bank in the world, the top investor in the world, and the richest man in the world, decided to join forces in 2018 and created an entity called Haven, which is now led by Atul Gawande, probably the top medical celebrity in the world. And they decided that they could transform healthcare. Combined, they have 1 million employees. So the idea is to use their own workforce as a living lab to experiment about how to provide health services. And I'm sure how to sell it to the rest of the world. Are they our new bosses? My father and my grandfather were physicians. These kind of questions would horrify them. But I think these kind of questions are the ones we need to be devoting more and more time to ponder. Because if we don't give ourselves permission to imagine a different future and to go a little further and make efforts to create it, others will do it. Are we prepared to do it? Are we prepared to give ourselves permission to reimagine medicine and to reinvent it? And if so, what we would like it to be? Okay. One scenario is that this becomes something completely different that doesn't require people like us to go to medical school and train for a long time as professionals, but that we become technicians. And that may be okay if that's what we would like to become. And that we would be doing things that machines couldn't do, or that would be very expensive if machines did it. And this would basically require that we continue the trend that began in the 20th century towards super specialization. So each of us will be focusing on a piece of the action, and there will be very strong indicators of performance that would be used to judge whether we should continue performing those tasks or whether we should be replaced by other technicians. The majority of us, in the meantime, may end up just providing services in the back of shops, as it is already happening, okay, ensuring that we prescribe stuff that will be sold at the front, until we disappear completely. So are we prepared to imagine the possibility of medicine existing for a little while without physicians? Because it may be too hard for us to imagine a world without medicine. But are we willing to consider the possibility for medicine to exist without physicians? Well, others are doing it already. And digital technologies will likely contribute to making this scenario possible. And not very, very far in the future, because many of us would say, hey, this would take a long time, I would not see it, even if it happens. And there is a lot of interest to go for the heart of what physicians are meant to do within the current umbrella that we know as medicine. Remember, this is a $7.2 trillion US a year industrial complex, about 12% of the world's GDP. is up for grabs. And most of the biggest companies in the world, most of which are not apparently working within the medical environment, are making huge investments to try to tackle what is at the heart of medicine, which is disease. Either to dissolve it and make it disappear, or to eradicate it, going all the way to curing even death. And there is an initiative called the 2045 Initiative that is receiving a lot of support from some of the richest people in the world. And they believe that by that date, 2045, thanks to the Internet of Things, we could become avatars that would manifest through the net and that would not need this organic substrate anymore. Should we be part of these conversations? Should we care about these things? And if so, what should the role of meetings like this be? What should our role be as members of the Canadian Medical Association? Are we prepared to give ourselves permission to believe that there is some validity or at least some possibility of a threat coming from these sectors? Okay. And even from within, we are starting to plant the seeds of our replacement. There are some of us who believe in a world in which all we would need to do is inject something or rub a cream with nanotechnologies. And whatever we put there would go diagnose a problem and fix it on the spot. Okay. Would we need years of training to put a cream on somebody? Okay. So it may be time for us to press the pause button. Okay. So what if we gave ourselves permission to be urgently patient and to stop and say, what if? What if we could reimagine medicine? What if we could reinvent it? What should we protect at all costs? And this is the kind of questions that occur to me when I'm crawling with my grandchildren and trying to understand the world through their eyes. I said, what should we protect at all costs so your humanity can be protected? Okay. How could we future-proof what we value most? This requires answering the question, what should we value most? Is it connectedness? Then why have we allowed consultation time to go down so badly? And empathy to almost disappear. What should we value more than anything else? And it's perhaps only when we experience the system as patients that we have the best opportunity to do so. And this happened to me in 2008. I had a possible diagnosis of cancer, which was ruled out. But even wearing a gown was a big challenge. Should I wear one and leave my front open or my back? I had a colonoscopy done. And while I was waiting, people were making comments there about the most private things. And it was like a production line. Burnout people all over. And while I was recovering from one of these things, a lot of questions started to emerge. And one of them was this: what do we really want? Okay. I was looking around to my fellow patients and my fellow healthcare professionals. Says, what do we really want? Do we really want this? I can tell you it sucked. It was horrible. The whole experience from end to end at a place that gets billions of dollars a year in budget. Okay? There was a piece of meat there along a production line run by technicians who didn't care about me or anybody else. Lots of compassion fatigue, I guess. And my conclusion was this: none of us would like to be here, was my conclusion. Because we would all want to be healthy. I want to be healthy until my last breath, if I can help it. Who here would like to be unhealthy? Raise your hand. Okay. So that very year, in 2008, I had the opportunity to issue a challenge with Laura O'Grady, who was working on her postdoctoral fellowship with me. And we wrote an editorial in the British Medical Journal and invited the world to join forces to try to answer this question. What do we mean by health? Because when I was there in the hospital saying I would like to be healthy, horrified, I realized that I did not know what health meant. And this is after a few medical specialties, a couple of doctorates, several titles with health on them. Okay? So what is health? You see. And realized that the definition that the World Health Organization had proposed 60 years before wasn't helping very much. I said, health, of course, the WHO definition. Okay? And this is it, right there at the beginning of the constitution of the WHO. Health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. And I found myself at one of these events that were celebrating the 60th anniversary of the WHO. And I couldn't help it. There was an open mic, and I said, what is health? And they threw this definition at me. And I couldn't help it. I said, raise your hand, as I would like to invite you now. Raise your hand if you have complete physical, mental, and social well-being. Complete. If you're wearing glasses, you're screwed. If you want to pee, you're screwed. If you didn't sleep well last night, you're screwed. If you're worried about something, you're screwed. You're not healthy, you're not healthy, you're not healthy. Raise your hand if you have complete physical, mental, and social well-being. There you go, Paul. We need to chat. I will open your mouth and find cavities there, I bet to you. Because as a physician, health for me is a state of incomplete diagnosis. Okay? So even if you are healthy, most of us here are not. And this definition of health is still the definition of health for the world, which condemned us, most of us, to be not healthy. So we have focused on eradicating disease. Of course, that's what medicine is about. So, 3 years later, thanks to support from the government of the Netherlands, a group got together and collated the responses we got through the British Medical Journal. People from all over the world contributed to this effort. And this is what we proposed in 2011. We proposed to consider health an ability. The ability that we have as individuals or communities to adapt and to manage the inevitable challenges that we face through life, physical, mental, or social. Health as an ability, not as a condition. So if health is an ability, all of us might be able to develop it if we don't have it. And it might be possible to position health as the main indicator of what we do. If you look at the WHO indicators, none of them have to do with health. Most of the ways in which we assess our performance have nothing to do with health. So what if this simple question became the main one? In general, and by the way, this is the first one on the SF-36 or any of those quality of life tools. In general, would you say that your health is poor, fair, good, very good, or excellent? If it is poor or fair, it would be considered negative. If it is good, very good, or excellent, it would be positive. So raise your hand if your health is negative. For the record, nobody here. Negative. Paul, you're crazy. Okay, so raise your hand if you consider your health to be positive. Good, very good, or excellent. Okay. Not sure? Raise your hand. Don't care? Okay, it's pretty much 100% of the people here. So we're all healthy. And you're wearing glasses, and how many of you have high blood pressure, or a diagnosis of cancer, or diabetes. So it is possible to be healthy even in the presence of disease. And even in the presence of multiple chronic conditions, what we still call chronic diseases. And this is data from the same year, 2008, showing that even people with 3 or more chronic conditions would consider their health to be positive. And these are people, Canadians, over the age of 65. Okay? So most people have positive health. What if, instead of talking about precision medicine, we started to talk about precision health? What if our main role, especially with the use of these digital technologies, would be to enable people to experience positive health by preventing the preventable, by curing the curable, by controlling the controllable, by relieving the relievable, by transcending the inevitable, and by being with each other always. Okay. What if we applied that to our own families and to ourselves? Now that we are all healthy, what if we went home and said to the people we love, hey, in general, how would you regard your health? What if that was the first question we ask people when they come to our consulting rooms? In general, how would you rate your health instead of what is your problem? That usually leads to things that cost money, prescriptions, lab tests, referrals, or sick leaves. And that's what we do within our family. We're ensuring that we are all healthy. What if organizations of different types decided to become healthy using self-reported health as their main outcome? And this is what we did with the Colombian Federation of Coffee Growers. Okay. By the way, this is the largest rural NGO in the world with 2 million people as members. So we worked with their employees, 3,400 and a bit, and 92% of them replied to the survey, and 94% considered themselves to be healthy. Only 4 reported negative health, and we looked at them. And by the way, in none of the cases, none of them required medical intervention. And we collected over 21,000 pieces of qualitative information and created some tools that allow us very quickly to find out what people consider as the main reason why they feel healthy or not. And then we ask people, what do you need to ensure that if your health is negative, it shifts to positive? And if it is positive, it can be maintained as positive. And consistently, in less than 10% of cases, the answers are medical. Then we went further, and working with a sort of insurance company in Colombia, we said, what if we blow this up a bit? This group supports 1.3 million people in Bogota. And 35 organizations decided to get together, and they said, we want to bring the best knowledge from around the world to see how much health we can achieve. And the Colombian government allocates $500 US per person per year, which is equivalent to about 1,000 Canadian in purchasing power. Okay? This is about 1/5 of what we spend in Canada. And we applied indicators of performance that the OECD uses to compare the 36 countries that are members of that club. And this network in Colombia that brought all of these innovations together and based their decisions on trust. They said, we are stuck here, we don't like each other, we think we are all going to screw each other, and we cannot continue like this. We worked on trust, we brought the best innovations from around the world and ranked #1 on these indicators. On 12 out of 13 quality indicators, this ranked number in the top 10, and 90% of random samples, representative samples of the 1.3 million people, consider themselves healthy. And listen to this, 95% of the professions too. Okay? So what if, in Canada, we decided to build the healthiest country in the world? And that we decided to lead this effort. And that this created an opportunity for us to show how medicine should be. And this would not be very hard, by the way. These are data from the latest census. And data also collected from the Canadian Community Health Survey. And it shows that less than 13% of Canadians consider their health to be negative. And the question is, what could we do to enable them to experience positive health, and how could we enable those with positive health to maintain those levels? What if we went a little further and said, Canada will become an example for the world, and we have every culture here. So what if we could work with every community living in Canada with roots all over the world, and decided to join forces to complete a pandemic of health? Well, we would not be very far, because after analyzing 2 million data from about 120 different countries, and this is self-reported health data, over 72% of people consider their health to be positive. We're talking about 5.5 billion people, and we are looking at the determinants of health, which are not really determinants of health. Okay, they are really determinants of the reduction in prevalence of disease, to see whether all that work applies to self-reported health as the dependent variable. But we are finding that so far Australia is the only country where women seem to have greater levels of self-reported health than men. Lots of opportunities for digital technologies to be used to achieve massive individualization, which is what these companies are doing with us now with all these apps. Okay. I have my own profile, my own needs are satisfied by this, and it's just a finite number of tools. What if we believe that we can do the same in terms of health? Okay. What if we led efforts to make the world a healthier place, and we started to think beyond human health and considered just as important to enable any other living creature, animal or vegetable, and beyond, to be able to manage the challenges that they face through their own lives? What if we decided to shift our usual stance, which is seeing is believing, to believing is seeing? What if we gave ourselves permission to believe in a different reality? What if today is the day when we begin that journey? Thank you very much.